In this session, we are going to look at the Braden Scale. It is used for the assessment for pressure ulcer risk. Hi, I'm Mrs. Sharon. I'm working as an assistant professor at M College of Nursing. The objectives that are addressed in this session are defining the Braden Scale, mentioning its purposes, discussing the time of assessment, briefing about the articles required, describing its subscales, interpretation and scoring, listing the limitations, and finally enumerating the role of nurse. Moving on to the introduction, reduced activity and prolonged bed rest, especially in those with neurological and musculoskeletal conditions, can lead to the development of pressure ulcer or bed sore. Research shows that pressure ulcers and the treatment negatively affect every dimension of a person's life, such as emotional, mental, physical, social, and as we all know, financial. Pressure ulcers are very expensive to treat and they further extend the hospital stay of the patient. That is where the Braden scale comes into play. It is a tool that was developed as early as 1987 by Barbara Braden and Nancy Bergstrom. It is one of the most validated and reliable risk assessment tools in comparison to the assessment or prediction of pressure ulcers. Let's look at the purposes. It helps the healthcare professionals to foster early identification of patients at risk of developing a pressure ulcer. It acts as a guide to initiate and implement preventive measures, and it also provides a source of documentation. The time of assessment, meaning when all should we do a Braden scale assessment. It has to be undertaken within 6 hours of admission of a patient or a first visit along with full skin inspection. It has to be repeated when the clinical condition of the patient changes or when the score is 18 or less, or at regular intervals if the patient is stable at least once per shift. The usual time that it takes for completion is 10 minutes. Regarding articles in assessment of Braden scale, no special equipment or activities are required. It can be done based on client interview, observation, or chart abstraction. This is the Braden scale. As you can see, there are 6 risk factors such as sensory perception, moisture, activity, mobility, nutrition, and friction and shear. They are graded on a scale from 1 to 4, with 1 being completely limited and 4 being no impairment. The scores from the 6 categories are added and the total score indicates a patient's risk for developing a pressure injury or ulcer. The scoring and interpretation will be discussed later. Now we'll be looking at the 6 risk factors and its preventive measures or nursing interventions in detail. The sensory perception risk factor is defined as the ability to respond meaningfully to pressure-related discomfort. If the patient is unable to feel pressure-related discomfort and respond to it appropriately by moving or reporting pain, they are at high risk of developing a pressure injury. This risk category describes 2 different issues that affect sensory perception. The first description refers to the patient's level of consciousness, and the second description refers to the patient's ability to feel cutaneous sensation. As you can see, the description of each level of risk from 1 to 4 with associated interventions for each level. These can be followed to minimize the risk as much as possible. The moisture risk factor is defined as the degree to which the skin is exposed to moisture. Prolonged exposure to moisture increases the probability of skin breakdown. Moisture can come from several sources such as perspiration, urinary incontinence, stool incontinence, or wound drainage. Frequent surveillance, removal of wet or soil linens, and use of protective skin barriers greatly reduces risk factor. The following are the levels, as well as you can see the associated nursing interventions. The activity risk factor is defined as a degree of physical activity. For example, walking or moving from a bed to a chair reduces a patient's risk of developing a pressure injury by redistributing the pressure points and increasing blood and oxygen flow to areas at risk. Level of activity is defined by how frequently the patient is able to get out of bed, move into a chair, or ambulate with or without help. The following table describes the levels of risk from 1 to 4 and also the associated nursing interventions to prevent any pressure injury. The mobility risk factor is defined as the patient's ability to change or control their body position. For example, healthy people frequently change body position by rolling over in bed, shifting weight in a chair after sitting too long, or by moving the extremities. However, tissue damage will occur if a patient is unable to reposition on their own unless the caregivers frequently change their position. The following are the levels of risk from 1 to 4 and also the associated nursing interventions. Adequate nutrition and fluid intake are vital for maintaining healthy skin. Protein intake in particular is very important for healthy skin and wound healing. The nutrition risk factor is defined by two categories of descriptions. The first category measures the amount and type of oral intake, whereas the second category is used for patients receiving tube feeding, total parental nutrition, or if they are prescribed any clear liquid diets or NPO status or nil per oral status. The following again you can see the level of risk from 1 to 4 and the associated nursing interventions to be implemented. Moving over to the final risk factor, that is friction or shear. Friction and shear are significant risk factors for producing pressure injuries. This category only has 3 ratings, unlike the other categories that have 4 ratings, and is rated by whether the patient has a problem, potential problem, or no apparent problem in this particular area. And the associated nursing interventions are also described here in this table. How to score the Braden scale? Each risk factor of the Braden scale is rated from 1 to 4 based on the patient's assessment findings. When using the scale, start with the first category and review each description listed across the row for each of the ratings from 1 to 4 and choose the one that best describes the patient's current status. Continue this process for all the rows. Add all 6 numbers to determine a total score and then use the total score to determine if the patient is at mild, moderate, high or severe risk for developing a pressure injury. The total scores range from 6 to 23. The lower the score, the higher is the risk of developing a pressure injury or ulcer. The interpretation are as follows. Very high risk when the total score is less than 9 or equal to 9, high risk total score of 10 to 12, moderate risk when the total score is within 13 to 14, mild risk when the total score is within 15 to 18, and there is no risk when the total score is between 19 to 23. The higher the score, the more aggressive the actions to be taken to prevent or heal a pressure injury. The limitations in using a Braden scale is that it does not consider pre-existing or previous pressure ulceration. We have already seen the nursing interventions associated for each of the subscale in the Braden scale. The overall role is assessment and reassessment based on hospital policy with proper documentation, implement the preventive measures according to the identified risk, document and evaluate its effectiveness periodically, provide patient and relative education regarding prevention of pressure ulcer.